Okay, I'm scheduled today to give insulin, so I'm going to just wash my hands. I'm going to come to the med cart, and I'm going to be able to pull out my insulins. And I find I'm a collector, and I'm a collector. I'm going to bring those out. And again, that's my first check, is just pulling them out of the drawer. My second check then is going to be against the MAR. I'm going to look at the MAR, and this is I'm a collector, and it is for February of 2013, and she's not allergic to any medications that she knows. She just has hay fever. And the first insulin we're going to check is her regular insulin. So again, this is I'm a collector, and this is I'm a collector. It's regular insulin, and we need to check the expiration date. And the expiration date of the whole vial is 12 of 2014. But once they open the vial, it's only good for 28 days. So it was open on the 25th, and it's good till March 24th. And that's my second check. All right. And my next check is going to be I'm a collector, and it is for NPH insulin, and this is NPH insulin. And both of these insulins are due at 7 o'clock. So that is my check. I'm going to let my instructor know that I'm ready to give my insulin. Luann, I'm ready to give insulin.
Okay.
Okay. I need to wipe off both of these with alcohol, but the first thing I'm going to do is actually rub. I can invert my NPH because it actually has some proteins that settle out on the bottom, and I'm also going to roll my NPH.
Good job.
Good, and that's mixed. We really don't have to rotate, but again, I'm going to just take a look and make sure that it's clear, and it is clear. And again, we've looked at the expiration dates on both of those. Okay, good. And now I'm going to wipe off each vial with alcohol, and for about 15 seconds, and allow that to dry. Okay, I'm going to look at my insulin. This is an insulin syringe. It does say that it's an insulin syringe, and it is a 29 gauge 1/2 inch needle made just for insulin. And I'm going to open the package. When I look at the syringe, I have odd numbers on the left-hand side and even numbers on the right-hand side. I'll pull down the plunger so you can see. Odd on the left-hand side, even on the right-hand side.
Are those units?
Those are units, and it actually tells you that on the bottom here. Okay. And our standard dose of insulin is actually U100. There's 100 units in 1 milliliter of fluid, so that is a standard dose, and both of those are the U100s. Okay, when I look at my MAR, I need to mix these insulins. They are compatible, and what I need to remember is I need to keep my clear. So we always draw up clear before cloudy, but I need to inject air into my cloudy first, which is my NPH. So my NPH has a total of 10 units, okay? So again, I'm gonna look, and it is for I'm a collector, and I'm gonna draw back air to 10 units. As I pull this off, I'm gonna make sure that I go into the top of the vial, and that I push that in, and that I don't touch any of the solution, okay? If I come back and look at my regular, I have 20 units I need to inject into there, so I'm going to pull back to 20, and I'm going to inject 20 units of air into my regular. I'm going to inject that in, and I'm going to invert my vial, and I'm going to just turn it so that I can see it. I'm going to pull back to 20. Now if I see there's an air bubble in there, I can push it all the way back in, because insulin needles are really, really fine. If you start tapping, you probably will bend the needle. So what I'm going to do now is I'm going to actually hand this insulin syringe to my instructor to verify that this is indeed what it is. So she's going to tell me how many units I have.
Beautiful. Looks like 20 units of regular. Good.
Okay.
Mm-hmm.
So again, we're going to pull that out of there. And I have my 20 units of regular insulin, and we've already checked the expiration dates. Now I'm going to go back into my NPH, and I need to make sure that I draw out 10 more units of NPH to total 30. And here, I need to be very, very careful that I don't go over because if I go over, I can't waste any because it's already a mixture. I would have to start over. And I'm going to hand that to my instructor to check to make sure that that's exactly what it should be.
That looks great. There are 30 units total.
Okay, thank you. And I'm going to just pull up my sheath. Okay, so we're going to go through our third check now to make sure that we have the correct medication. And so this is I'm a collector, and this again is I'm a collector. And she has no known allergies. It is for February, and it is regular insulin. This is I'm a collector. I'm a collector. This is our regular insulin, which is U100. And it is our 20 units that we drew up. Our second one is I'm a collector. I'm a collector. And it is NPH, which is NPH, and it is the U100. And again, our expiration dates, just visualizing it, are both okay. And that's our third check. So we're ready to go into her room. The one thing that we might want to take a peek at is the last time. They generally document the site because we want to rotate the site. So we would look and see where the resident had the injection last so that we could rotate sites. All right, we'll go into her room to give her insulin injection.
Come on in.
Hi, Ima.
Hi.
I'm back.
All right.
I have your insulin injection. I'm going to just wash my hands here. Can you tell me your name and birth date, please?
I'm a collector, 7/15/40.
Very good. We took your blood sugar this morning, and it was a little on the high side. It was 168, so I do have your insulin this morning, and we'll be administering that shortly. Do you mind if I just demonstrate where we could give subcutaneous injections?
That's fine.
Okay, the first we're going to start on your back.
Okay.
Generally mid-scapula to kind of a little bit below the bra line. There's tissue there that you can pinch for subcutaneous tissue. Also dorsal and ventral gluteal here are sites as well. We typically don't use a whole lot of those sites. If you want to go ahead and lie down.
Okay.
There's a couple sites that we can use on your arm. So the posterior part of your arm right here, you have a little bit of subcutaneous tissue. Okay, and also abdomen, you want to visualize the umbilicus. You want to stay at least 2 inches away from the umbilicus.
Okay.
Okay, and then the other area you can give is the anterior thigh here.
Okay.
Okay, so typically in a clinical setting, we usually use most often the abdomen, posterior arm. Sometimes we use the thigh. Don't use the other sites very, very often, but again, they're there in case we need them.
Okay.
So today, we need to give your insulin injection. So again, if I just pull that up a little bit, I would stay at least 2 inches away, generally in the lower area here, and I would stay away from any lesions, any scarring, any bruising, any area that causes you pain. The other thing is we want to rotate the sites when we give insulin so that it's not all the same injection each and every time. Okay? I'm going to actually just have you hold that there.
Okay.
Okay. I'm going to go and get my gloves, and I'm going to have some alcohol here. Generally, if we can pinch more than 2 inches, we can go in at a 90-degree angle. Okay, so on your abdomen, you always want to make sure that you pinch, if they do have rolls, that you pinch with the roll. Once you've determined the site that you're going to give it in, you can take your alcohol pad and you kind of wipe, just in a circular motion, out about 2 inches. Put your alcohol pad right above that so that you know exactly where you wiped with alcohol. That gives you enough time to come over and take a look to make sure that you have the correct dose of your insulin again so that the plunger didn't get pushed anywhere. Once that's dried, we can go ahead and pull this down. It'll kind of click down. Okay, and what we want to do is we want to go ahead and pinch this. And we're going to tell them on the count of 3, you're going to feel a little poke on the count of 3. 1, 2, 3. It's just a little push in. We're going to stabilize with our non-dominant hand. We're going to go ahead and push in. Again, it's about 5 seconds for a 0.5 milliliter. And once it's in, we want to count to 5 to ourselves. And once we're done, we're going to kind of depress the skin, kind of hold it, and pull that straight out. If it's bleeding, all we want to do is take the alcohol pad and just apply a little bit of pressure. Okay, then we need to engage our safety device. So if we pull it up and we turn it actually to the left or clockwise, you'll hear it click, and we can't pull that down any further. If you're in an acute care setting, they probably have a sharps container in the room. If you're in a long-term care setting, you might have to go back to the nurse's cart or the med room in order to dispose of your syringe. So now we would be able to document that we gave our insulin. One other, just for the demonstration purposes, I want actually Ima to go ahead and sit up at the side of the bed.
Okay.
So when you have someone who is very thin and who has not a whole lot of subcutaneous tissue,
Luann has more than 2 inches here.
so we would have to give it at a 90, but for demonstration purposes, if she was a very thin person or a child and you could pinch less than an inch, what you could do is you can go ahead and give it at a 45 degree. And so if you wanted to check to see if you were actually in the muscle, you could have them flex and extend their arm. And if you would feel any muscle movement, you would know that you would have to redistribute and pinch somewhere else to see if you feel that. And again, because she has a little bit more tissue, we would go in at a 90 for her, but small children.
Less than 2 inches, you would go in at a 45-degree angle.
So you're saying I have a good amount of subcutaneous tissue.
You do, but for demonstration purposes, I'm going to have you actually hold this.
All right.
And when we actually give a subcutaneous at 45, we're actually going to give it at a little bit different angle. You actually want the palm of your hand kind of up. So I just have another syringe here that I believe I have a 0.5 milliliter in. And I'm going to pick that site again, and I'm going to wipe that site and just leave that right above where I wiped. I'm going to come back and I'm going to take off my cover.
Pinch less than 2 inches.
I want to make sure that I go kind of at a 45 degree. The rest of the procedure is the same. Little poke in. I'm going to stabilize with my non-dominant hand. I'm going to go ahead and push that in slowly with my palm of my hand up. And then I'm going to count to 5 to myself. And then I'm going to pull that out. If there's any bleeding, I just apply a little bit of pressure. And then I'm going to engage my safety device here as well. And I'm going to turn that clockwise or to the left. And you heard it click, so that's safety. Okay, some hospitals actually have insulin pens, and it's very easy to use. You go ahead and you pull off the top. It's just like a vial. It has a little rubber stopper on the top. No different than any other vial. We have to wipe it off with alcohol. So you want to wipe that off for 15 seconds. Okay, and then there's a needle here, and I'll show you that. See, there's a needle here that actually goes through the rubber stopper, and you just turn that in till it meets resistance. We have to prime our needle, so in order to prime our needle, we're going to click it up to 1. That's 1 unit of insulin. We're going to look at the top. When I press this out, we're going to look to see if any liquid came out. If it didn't, I'm going to do it again so we actually can see liquid come out. And liquid did come out there. So what we need to do, if we have a person that has an order for, let's just say, 4 units of insulin, what we could do is click it up to 4. 1, 2, 3, 4. And we're actually on 4. And we don't have to draw anything up because it's all right in here. This as well is 100 units per milliliter as well. It comes in 3 milliliters total, but again, there's 100 units per mil. Hi, Ima.
Hi,
I'm here to give you your insulin.
Okay.
Okay. And can you tell me your name and birth date?
I'm a collector, and it is 7/15/40.
Awesome. Can you put your bed up for me?
Oh, sure.
Because we just went through all of the different injection sites that we can give insulin in, I'm not going to go through that again. We're going to pick out the abdomen to give her insulin in. And giving it via insulin pen is a little bit different than with a syringe. So, just put these gloves on here. And you hold it just a little bit different. So the same goes for this type of insulin, you want to make sure you know what their AccuCheck is and that it's okay to go ahead and give their insulin.
All right, how's that?
Okay, that's perfect. So I'm going to note her umbilicus, and I'm going to go at least 2 inches away from there. And again, I'm going to pick a site, and then I'm going to wipe about 2 inches around, and then I'm going to put that right on the top, and I'm going to go ahead and let that dry. With this type of insulin pen, when I pull this off, you can see there's a little plastic sheath on the end. The needle is actually underneath this plastic sheath, so it's not like a poke in, and I'll show you how to do it. But when this sheath goes up, then the needle actually pokes into the skin. Once this comes down, these areas here will have a red marking in, and that means the safety device is activated. When you give insulin with an insulin pen, you almost want to hold it so that your thumb goes over the top of the pen like this. Okay? So what we're going to do is I'm going to tell Ima that I'm going to go ahead and give you your insulin.
Okay.
And again, if they have rolls, you're going to pinch just like you would with a regular insulin injection. And you're going to go ahead and on the count of 3, I'm just going to push it in. Ready? 1, 2, 3, and I'm going to push it in. And I'm going to stabilize. And I'm going to click it down. Now once I click it down, I want to count for 6 seconds. Because the insulin takes time to come out of the pen. So once that's done, then I pull this back up, and you can see that there's red there, and that's the safety device, so that this plastic sheath does not move anymore. It's not going to poke or injure any of the healthcare providers. Okay, then what I would do is I would put this in the sharps container, just the top of this. I would go ahead and put that in the sharps container. And then I just need to make sure that I recap that, and we can put that back into her drawer. Okay, so now we're back at the med card, and we need to document. And again, I'm just making sure that I'm a collector, and it is our 7 o'clock dose of insulin, and it is the 26th today, so we're going to come all the way over to the 26th, and we're going to go ahead and initial that we gave that. The next line down, it actually says what it was the site. There's a little key up in the upper left-hand corner up here, and we actually gave it in her abdomen right, so that would be the number 8. So we would come back here so that people would know where we gave it the last time. We would write the number 8. We also gave the NPH insulin the 10 units at 7 o'clock, so we'd come across here and we would put our initials here, and we gave it at the same location, so we would put an 8 there. And then we would be able to put away our medications.